Dr. Centeno, and welcome to the COVID Fact Fiction Show that I do every Wednesday, episode 4. So this is both a video and a podcast. So if you've got friends that are interested in stuff like this, please share this widely. So listen, I do an update on masks all the time because it's one of the more contentious issues. Again, I wear a mask where they tell me to. This is my N95 mask. I've got a number of them that I wear in the office every day. I wear a mask outside every place they tell me to. So I've got no issues with wearing masks. My issue is the science is being hyped and exaggerated way beyond what we know about COVID-19 and masks. So you may have seen these news stories, basically that a study showed how unbelievably effective masks were to reduce the spread of COVID-19. Now this is a hamster study, and it's important to understand what this study really is. My wife actually brought this up to me because it was out on katiecouric.com or whatever that is. And this was about hamsters and surgical masks. Now, what's interesting is they didn't make hamsters wear surgical masks like you see there. In fact, what they did is they put a surgical mask in the air circulation between two hamster cages. Now, it doesn't take a rocket scientist to figure out that that study doesn't really apply to the real world. So there was a reduction in the transmission of the SARS-CoV-2 virus or the coronavirus between one cage and another when they artificially infected some of the hamsters in one cage with the virus. However, there's huge problems here. Obviously, this doesn't really translate to mask use in humans in any substantial way. And with surgical masks, the air just goes up, down, and around. So you're contaminating the air, if that's possible, around you with a mask on or a cloth mask or any other type of mask that isn't an N95 mask like this one. And obviously, we don't know how reducing hamster infection rate translates to the infection rate in people. And this is just not real world. So interesting study, and I'm glad they did it because it adds to the body of evidence, but it is absolutely positively not translatable to humans and what's happening out there every day. So let's talk about the kids camp panic porn. This came up this week. The headlines: hundreds infected with coronavirus at Georgia camp, raising fears about risk for children. So as I've said before here, this is not a political show. I'm apolitical. I don't care if it's Fox News or CNN. I'm going to go after everybody who puts out panic porn. So basically, this is the study out of the CDC they're talking about. And there were a bunch of infections in a Georgia camp after one of the teen camp counselors ended up having coronavirus, and then they tested everybody. Now, it's not like anyone died, no one got sick. These are kids. Kids do not die from coronavirus unless there's something going on that's very serious with them. So this was a very low-risk event, but it was used by the media to try to push the concept that we can't send kids back to school. And really what we're talking about here is a super spreader event. We know that a very small percentage of patients with coronavirus seem to be able to infect many more people. And that's likely what happened here. So we took a rare super spreader event, and we've had a number of these throughout the last several months. And this was blown up into, this applies to everyone, every place, which it does not. Fauci goggles. So I put some goggles on Dr. Fauci's picture here. Hey, listen, I like this guy. I think he's a good scientist. I think he is trying to do the best. But like everyone, this last week he had a real humdinger that he shouldn't have said. Basically, he suggested that we should all wear goggles and face masks, and he didn't really say that. What he said is if you're trying to ultimately protect all of the mucosa, which is the stuff in the eyes and the throat and the nose, from coronavirus, then it might be good to do this. Now, regrettably, this is really a hospital thing. So if you're a doctor like me and someone is coughing in your face, it's a great idea to have a face shield or goggles on. For the average person outside, obviously, a face shield, you're just going to get air going this way, coming in that way. So it's not really going to give much protection because there's a free exchange of air going back and forth there. But again, if you're working with people that are coughing in your face, this could be very helpful. So again, we took a hospital concept and it somehow made it out into the media as a general public recommendation. Now, thankfully, I've not seen too many idiots out there wearing face masks and goggles, and hopefully I won't see that because, again, it's not going to offer much protection to the average person that's not working in a hospital or a clinic with patients. So let's talk about another shutdown, right? This has really been floated this week in the media as well as last week, the concept that we need another shutdown if we're going to do this right. There was a letter circulating that I talked about on the last show, and this has continued to be something that's being pushed out there. And what's really interesting about this is it's being pushed because there's this concept that we don't have enough hospital beds, and that's actually not true. I've reviewed that many times. We have more than enough hospital beds in almost all areas of the U.S. We have more than enough ICU beds in almost all areas of the U.S. The problem is that these hospitals are now understaffed. So they don't have enough staff to staff all the beds. And why is that? Why did they get understaffed? Because hospitals started to furlough employees as soon as the first shutdown happened. And they furloughed employees because they were told not to do elective surgeries. Elective surgeries are the major income driver for a hospital. Hence, their income went way, way down, and they had to furlough staff. Hence, we now don't have enough staff. So again, let's not get into this same shutdown hole that we were into before. Obviously, we're going to destroy these hospitals. We're not going to have enough staff to do this because once you shut down elective surgeries, hospital income goes way, way down. So you can't do that because you're creating your own problem here. And this is just some information on the economic impact of Shutdown 1. And it's a disaster. I'm no economist, but I can look at a graph and see national debt going up. I can see consumer confidence falling off a cliff. I can see loans to the private sector going up. I can see GDP off a cliff down. So we probably won't survive a second body blow if we shut this all down, in addition to destroying hospital staffing again, which is what we're going to need. So what's the good news? I always kind of finish this out with good news for the week. So what was the good news? Well, it's incredibly important that you understand the couple stories that have just started to circulate and will probably be much more popular going forward, and that's on T-cell coronavirus immunity. And it involves what's called memory T cells or the killer T system. So basically, it's critical that you understand that we've been talking about antibodies. And, we've been looking at the prevalence of antibodies, how many people have had this thing and have developed antibodies. But what we haven't really been measuring, and what's been huge, is this concept of T cells. So just to review, there's really two parts to your immunity. One part is the B cells, and those create antibodies. But then there's these T cells, and they actually create cells that can identify and attack and kill things like viruses. So you got antibodies on the one side, you've got T cells on the other side. Now we've only been measuring half of the immune system when we look at antibodies. We've not been looking at the T cells. And there's more and more data that T cells can kill this thing. So basically this was a Nature paper that talked about how there's this T cell immunity. And they went ahead and found out that about a third of the people out there, and I've talked about this before, have T-cell based immunity. And that's much, much higher than the number of people that have antibodies. And there may be some cross immunity for other coronaviruses. And you may have seen this week them talking about things like Vietnam, which has very few cases, and how this thing has been so easy to control in Asia. Some of that's because Asia is better at this stuff than we are. They've been dealing with SARS viruses for decades. But some of that could be because they've got cross immunity to multiple SARS viruses, whereas we don't. And that cross immunity is probably happening through T cells and not antibodies. So you got to realize there's those two sides to the immune system, and it may be that the T cell side, the part we're not hearing about much right now, the part that doesn't involve antibodies, may be critically important. And again, we're finally now seeing the media come 360. I've been 360 on Sweden now for months, saying that this data doesn't add up. Sweden isn't that bad. And sure enough, the media, there was this Bloomberg piece, there was a Washington Post piece. They're all now saying, that's interesting. Italy saw a dramatic reduction in cases and they shut down, but Sweden is also seeing a dramatic reduction in cases. And again, realize that some of that probably has to do with this T-cell immunity, meaning that this thing gets to a certain level in the community and then it starts to die off, because that herd immunity is happening more than on the antibody side. It's happening on the T-cell side. So even though everyone's hitting the panic button right now, everything's awful, et cetera, we may well see this go back down the other side because of this T-cell based immunity. And that T-cell based immunity may also explain what happened in Sweden, that Sweden did get to herd immunity. That's why their cases are going down. Now, we will see what happens once we get to the fall with Sweden. But if by the fall, Sweden's still looking pretty good, we're seeing T-cell based immunity out there, which is great news for everybody. So that's it. Thanks so much for watching the show today. I try to do this every week. Please, please, please share this with folks that are like-minded, that are really critical thinkers, that are trying to dissect what it is they're hearing. Because again, you see and hear these headlines and we all want to just go to our reptilian brain and panic. But you've also got to look deeper to really understand what's happening. So please share this with your friends, share it on Facebook, share it on Twitter, any place you can, so that we get lots and lots of people that get this type of information. Thanks so much for watching, and have a great day.